Well, this is a frozen image of a 45 years old female, and she has no menstrual disorder, no history of any menstrual irregularity, and has regular periods. Now, why this is an incidental finding or ultrasound that I have frozen on the image, on the ultrasound screen. Now, on the left side, this is the uterus in longitudinal section. As you see, this is the cervix, this area is the cervix, this is the anterior myometrium, this is the posterior myometrium, this is the endometrial canal central, almost appearing central but is not central. As you see here, it measures approximately 14.7, and from here it measures only 9.5. The reason being that there is a large fibroid. This is the fibroid. This area is all fibroid, having a heterogeneous appearance, mixed cystic and solid, and there are few cystic areas of degeneration and necrosis seen within this fibroid mass, or fibroid. In fact, it is a fibroid, and it relates to the posterior wall of the myometrium, and being large enough and protruding posteriorly, this fibroid is elevating the uterus. You see, the body of the uterus and the fundus are being elevated by this large mass relating to the posterior myometrium and then protruding posteriorly. This is the longitudinal section, whereby the length of the uterus is approximately 9.8 centimeter, and the anterior-posterior diameter is 3.1 centimeter. Both are within normal. This is the transverse section. This area is the transverse section of the uterus, this area up to here. And this central line, is echogenic line, is that of the endometrial canal, that measures 4.7 in very early proliferative phase. Now, these two cystic areas is the gallbladder, is the urinary bladder in transverse section, and you see that the uterus is being elevated by this mass, which extends posteriorly into the pelvic cavity from the posterior surface of the myometrium, posterior myometrium, and you can see this is whole fibroid. The rough measurement is 11 centimeter by this is a rough estimate, 7 centimeter, I will say. So, and now note the appearance. It is inhomogeneous, having solid element as well as few cystic areas. These are few cystic areas which are suggestive of internal necrosis or degeneration, along with few calcified areas giving sharp shadow posteriorly. So this is a case of posterior uterine wall fibroid elevating the uterus anteriorly towards the urinary bladder. Here you will see, I'm going to show you on real time, trying to align the uterus with the vagina. First of all, we will try to concentrate on the uterus. Now, this is the uterus in magnified view, the anterior myometrium of the body, the posterior myometrium, the endometrial canal, the fundus of the uterus, and this is the cervix. Okay, now in a bit low magnification, you see, now there is a mass seen, large mass, which is elevating the uterus anteriorly. And the reason why she does not have any menstrual disorder, she says she has regular periods, no issue with that, is because of this large solid mass relating to the posterior wall of the uterus, and with no significant vascularity, though a few vessels are seen. However, there is no significant vascularity seen, and this is the area from where we can get its real dimension. It measures approximately I have cut off the uterus. Now this is the actual size of the fibroid, which is 11.4 into 8.9, or we can say roughly 11 into 9 centimeters. Thank you very much.